There's a reason why so many songs, movies, books, and musicals revolve around the brokenhearted, because so many of us can relate to that. From a cardiology standpoint, though, doctors tell us broken heart syndrome is a diagnosis, and it's relatively new, so they don't have nearly the data that they do on other heart conditions. Do you remember the first broken heart you ever had?
Of course I do. The first one and the last one.
How old were you?
17.
What was his name?
Brian.
It could be argued heartbreak is the one universal human experience, whether it's a bad breakup,
probably 22, 23 years old, it happened in college,
or the loss of a loved one.
I was really heartbroken when my mom passed away.
We all know that gut punch that leaves you feeling like you may never be right again. And Dr. Travis Love says in some cases, a true broken heart can have devastating consequences.
It can be quite traumatic, and people will end up in the ICU with this, and people can even die from this.
The University of Kansas Health System cardiologist says broken heart syndrome is real. The more technical name for it, stress cardiomyopathy.
Most of these patients present like people who are actually having heart attacks, so chest pain, shortness of breath. A lot of the data that we find on these patients, their EKGs and their cardiac enzymes, are very similar to heart attack patients.
Most of the time, Dr. Love, and yes, that is his real name, says broken heart syndrome is treatable and reversible with medications and time. So it turns out time heals a broken heart is not just an expression either. There are other studies that show broken heart syndrome has become more common in the pandemic, with so many people isolated without their support systems. Doctors say 90% of the documented cases are also women around the age of 65.